I've been asked about the comments by many commentators that the current medical system is not sustainable, especially with respect to chronic illnesses. And here's what's happening with the current medical system. Number one, as we've mentioned before, how you make money in medicine is you do push them through faster, you play the coding game and sort of look over your shoulder and hope you don't get caught, or number three, you do more procedures, all right? Which is not a good model to be based on. Number two, what's happening is we have a marked shortage of primary care doctors and physicians. And those that are doing primary care, family practice, and internal medicine, primary care, bottom line, they're seeing anywhere from 40 patients and up a day. And you can't do good medicine. There's no time to do good medicine. The third thing that's happening that is sad, but we have more and more in our town, more and more urgent cares popping up to look after these cases. But here's what happens with the urgent cares. Two issues. Number one is that there's very little patient time, and there's very little patient-doctor relationship. So the urgent cares are worried about malpractice. And two things happen. They don't treat the underlying issues and problems. They're very poor at treating chronic illnesses. In fact, I think sometimes terribly at that kind of role. They're much better for targeting acute care, urgent care type things, but terrible for chronic illnesses. And what happens, they end up trying to cover their backside by only going so far. The classic example, I saw a person the other day that went to an urgent care twice because his blood pressure was up in the sky. He had diastolics of 180, systolics of 180 and the diastolic almost 120. And the urgent care doctor gave him 5 days of blood pressure medicine and told him to see his regular doctor or find one. To me, that he wasted. It cost that visit almost $1,000 for that man for 5 days of medicine with no long-term care. The cost profile of that is terrible, and that's happening around the country. Number two, those that don't have insurance are getting eaten alive by the urgent cares, or going to the emergency room, where it's very high cost medicine, with again the same chronic follow-up issues. All right. Now, where does the direct payment care practice fit into this model? Number one is that if you do a direct payment care practice model, we limit our doctors to 1,100 patients per doctor. This morning I saw 6 patients instead of 15, 20 like the average primary care doctor would do. And because of that, I'm able to do very good medicine. Number two, we're able to look at the root issues. Number three, we're able to build very good, strong patient-doctor relationships so that compliance goes to the roof. Number four, these patients have skin in the game. They're paying for this. The compliance goes way, way up. And what happens when you add those things together, plus you're able to do a little bit of more functional medicine type things to add in when you've got time to do it, amazing things happen from a patient cost perspective and a patient value perspective and from a patient health perspective. Amazing things happen.